TFL right up front here, and then in the back here you can't really see is a nice chunk of tissue, the glute max. Antoine's got a lovely glute max. How's it going, guys? Student Dr. Nick here with Dr. Antoine over at Kalkstein Chiropractic, your Baltimore area chiropractor. Today we're going to be shooting a clinical series we'll be posting more videos on our YouTube channel with. But the topic today, IT band tendinosis. So what is IT band tendinosis? That's an inflammation of the tendon of your IT band due to repetitive chronic use, seen a lot of times in distance runners or cycling athletes. Typically, how you test for IT band tendinosis is the patient will come in with a complaint of lateral knee pain that can either radiate up just a little bit to the leg or down below the knee here. So what we'll do in this office to really diagnose it is have the patient lay on the side here, bring this leg up, it's called O'Bears, and just relax that leg for me, Dr. Antoine, and just slowly let that knee drop. And what you want to see is that knee kind of curving down towards the floor. If it were to stay up like this, nice and rigid, that means that IT band's extremely tight, so we don't want to work on loosening that up. Next, you could also bring that leg up, add a little bit of pressure on the outside of the knee as you flex it forward, and you're feeling for any kind of popping or rolling of that tendon over that lateral femoral condyle there. And also, they say like, oh no, that's where I really feel the pain at. You know, you got a good idea of what's going on. So how we would treat it in this office is we'd start off with dry needling. We'd target the two muscles that insert onto the IT band. First of them being the TFL right up front here, and then in the back here you can't really see is a nice chunk of tissue, the glute max. Antoine's got a lovely glute max. So the kneeling's gonna help. Kneeling's gonna help relax those tissues. Those tissues are relaxed. It really helps put a little bit of slack down into this IT band. Afterwards, we do some soft tissue work, ART, just some muscle stripping, really kind of help break up those adhesions in the muscles that are causing that IT band to be tight. And afterwards we'd adjust. So you always want to look above and below the problem. Above, we'd make sure the low back and the hip is moving properly, as well as the knee and the ankle. So it's all a giant chain here. So you want everything to be running smoothly to really help get rid of this irritation that they have in the knee. So that essentially covers IT tendinosis. So if you have any other questions, feel free to comment down below. Thanks for watching, and don't forget to like and subscribe.